Have you ever seen those tiny red spots and wondered, what's the big deal? Well, today we're talking about measles, and trust me, it's a much bigger deal than just a few spots. This isn't just some old-timey illness from black and white movies. It's a serious and highly contagious disease that we all need to understand. So, what exactly is measles? It's caused by a virus that spreads through the air when an infected person coughs or sneezes. And when I say contagious, I mean it. If one person has it, up to 90% of the known immune people close to that person will also become infected. Think about that for a second. It can linger in the air for up to 2 hours after an infected person leaves the room. That's some serious staying power. The first signs usually aren't the rash. It starts with a high fever, a cough, a runny nose, and red, watery eyes. A few days later, tiny white spots, called Koplik spots, may appear inside the mouth. Then comes the classic measles rash. It typically starts as flat red spots on the face at the hairline and spreads downward to the rest of the body. Now, you might be thinking, okay, a fever and a rash, I can handle that. But here's where it gets really serious. Measles can lead to some severe complications. About 1 in 5 people who get measles will be hospitalized. The most common complications are ear infections, which can lead to permanent hearing loss and diarrhea. But it can get much worse. For some, measles can cause pneumonia, which is an infection of the lungs. This is actually the most common cause of death from measles in young children. Even more frightening is the risk of encephalitis, which is swelling of the brain. This can lead to convulsions, and it can leave a child deaf or with an intellectual disability. Roughly 1 to 3 out of every 1,000 children who get measles will die from respiratory and neurologic complications. And there's another scary, long-term effect called immune amnesia. Recent studies have shown that the measles virus can wipe out your immune system's memory. Imagine your body has a library of all the germs it's fought off before. Measles comes in and just burns the books. This leaves you vulnerable to other infections for months, or even years, after you've recovered from measles itself. So, you might survive measles, but your body is left wide open to a whole host of other dangerous illnesses. Before the measles vaccine was introduced in 1963, major epidemics occurred approximately every 2 to 3 years. Measles caused an estimated 2.6 million deaths each year globally. It was just a common part of childhood, but a very dangerous one. So, what changed? The MMR vaccine. This vaccine protects against measles, mumps, and rubella, and it is incredibly safe and effective. 2 doses of the MMR vaccine are about 97% effective at preventing measles. That's a stunning success story for public health. Thanks to widespread vaccination, we've seen a dramatic drop in cases and deaths. However, measles hasn't gone away completely. Outbreaks still happen, especially in communities with low vaccination rates. When fewer people are vaccinated, the virus has an easier time finding someone to infect and spreading like wildfire. This puts everyone at risk, especially those who can't get vaccinated, like infants who are too young or people with weakened immune systems. Protecting ourselves and our communities is a team effort. It's about creating a circle of protection, what we call herd immunity, to keep the most vulnerable among us safe. Talking to a healthcare provider is the best way to get accurate information about the measles vaccine and to ensure you and your family are up to date on your immunizations. They can answer any questions you have and help you make the best decision for your health. Measles is more than just a rash. It's a formidable disease with potentially devastating consequences. But the good news is, we have a powerful tool to fight it. By understanding the risks and taking action, we can keep ourselves, our loved ones, and our entire community safe. Thanks for watching today. If you found this video helpful, please give it a thumbs up and consider subscribing for more health information. Stay safe and stay informed.